Hi everyone, Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Diah Setyawati Dewanti. I'm one of the lecturers in the Faculty of Economics and Business. Today we will talk about health economics concerning health affecting to the poverty. Health poverty trap. As we can see, that low income tends to cause poor health, and the poor health will be turned causes the low income. How it will be? Because everyone who has a very poor health, they will impact to the effectiveness of their performance to work. The policy must therefore address for both, not only for health but also poverty simultaneously. So in Indonesia is, for example, this is what we have the conditional cash transfers policy we are trying to do, because they are trying to address the health and poverty simultaneously. So the conditional cash transfer is proposing the health for pregnancy women and also for infant. As we can see, the poverty affect the health, the theory behind it. As we can see, people cannot buy the health care. They are not afford to prevent the disease before it occurs. For example, vaccines. In the vaccines, we see that there's vaccines for the lung. TB, for example, is quite expensive. Not everyone can afford to buy that, and it can be cost to the healthcare. How to prevent the disease of TB for adult in the very young age. The second one, doctor visits for diagnosis. Not all of people or family can afford to meet the doctor occasionally or frequently. They're trying to diagnose by themselves. If they have a disease, if they have a flu, they're not thinking about they will meet the doctor eventually, but they will thinking about how to reduce it by themselves. And usually for the poor family, they will buy medicines which is actually, they do not know the prognosis of it. So the doctor visit for diagnosis usually is becoming a challenge for the health policies in one of the countries. The third, drugs to treat the problem. Usually we see in Indonesia, previously 5 years ago, the drugs usually it was sell freely. It's just like you want to buy some antibiotics easily. No need to have the prescriptions and no need to meet the doctors. So usually they will buy easy on the antibiotics, which is actually can impact others. Poor people, which is mostly having a very limited knowledge concerning for that. They will buy drugs easily and they will not thinking about it. For example, directly just, okay, you are having flu, then you buy the Tunsalos. Tunsalos is very, just like orange color, or it's not, you cannot buy it easily. So usually they buy drugs easily in some drugstore, and usually poor family, they do not have knowledge, more knowledge on it. So that's why the drugs usually they buy the drugs to treat the problem. The second one behind the theory of the poverty affects the health. The poor more likely to be malnourished on it. Usually the poor, they cannot afford the food or something to grow for the food using the chemical fertilizers. So they're not afford buying the food which is health for them. And they're not afford to buy the food which is the variety food bring the health. So the poor mostly are malnourished, which is effect to the health performance of the poor family. The second, immune system weak. Usually they have a problem or susceptible for the disease. So the weak of the immune systems, they are not afford to buy the vaccines. It also brings the problem for the poor people to health. And the lack of income to buy drugs in the pharmaceutical companies usually do not invest the drug development of specialized the disease. For example, the malaria. I still remember the case of malaria 20 years ago. It was very heavy cases. A lot of people die because of the malaria. And right now, at that moment, pharmaceuticals companies was adjust a lot of the drugs, but then it was very expensive. Since then, afterwards, a lot of companies collaborate with the universities trying to specialize the drugs of malaria. They're trying to specialize what is the cheap drugs which can be afforded to the poor family, but they can't cure the malaria disease. And the second one, the poor more likely usually to live far away from doctors and hospitals. Not only the distances, because usually if their home is near to the hospital or to the clinics, usually the house is quite expensive. The price is quite expensive. So the poor family more likely live in a very rural area. So they live in a far away from doctors and hospitals. Why it can be problem again? Because the transportation costs will be large. They have to take quite more expensive on the transportation costs, and the poor more likely not going to meet the doctor or hospitals, then they do not have untreated. And then afterwards, certainly for rural poor, they do not meet the doctors when they have problem on their health. As you can see, when they are poor and they get disease or they get sick, they cannot work very in the normal hours. So they need some helps. The first help that can be supported by the government is having the mobile health clinics or food doctors. I see that several of the in the rural area, for example, in some cases in Java Island, in some rural area, they have a mobile health clinics. They have food doctors. They're trying to reach to the poor. They're trying to see how the poor can survive, because they live far away from the doctors. So the most effective way is trying to have the food doctors. And right now, the government is trying to enlarge or develop this program to reach the poor for rural areas. As we can see if you want to have the research concerning for that, the poor less likely to be educated. As you can see, the poor mostly have less human capital score. If you want to see several of the, if you are reading the several of the papers, they see that the GDP, they have efficiency parameter for production function, physical capital, labor, quality of labor, or human capital. So it brings that the poor, who is less likely to be educated, or the human capital is decreasing, or not decreasing, the human capital is low, so it becoming the GDP of this country will be decreasing. Poor health also leads to the wrong choice of institution in a country. So the poor health, usually they are thinking about BPJS, the health insurance in Indonesia, becoming a wrong choice. They do not want to have the BPJS, the insurance for them. They think that it's too expensive and etc. But if the poor health family, they know what is the impact, the positive impact for the BPJS or health insurance in the country, they will understand that choosing the health insurance BPJS is the right choice. Health inequality usually leads to less social cohesion or becoming larger probability of unrest. And previously we talked about human capital means that the health will affect to educations. This mechanism which health affects to schooling, how it can be? The poor nutrition for the children will be leads to poor brain development and it becoming affecting to the learning process of the children. Now I understand that government is trying to see this problem, so they are trying to have the free lunch for the junior high school and high school, if I'm not mistaken. So they're trying to build the brain development for the gold age of the human being. So it hopefully can affect the learning process. Of course, the nutrition becoming the first options that government will need to see to send to the junior high school or high school students. Poor health leads to worse attention in class. When you have a poor health, it will be impact to the less immune. So it becoming people do not attend to the class, or the students will skip the class. So it can be impacted to their brain development or their performance of the school. The last one is mostly the parental death. If they do not take any seriously about this disease, the parental death is also occur. For example, concerning the lung or stroke or heart attack. So if they do not have any information concerning how to deal with the heart attack, parental death usually becoming increasing. So it also impact to the poverty of the family. So that's all about health poverty and educations or health and poverty. So thank you everyone. Let's close our class today with saying Hamdalah together. Alhamdulillahirabbil alamin. We will meet again in the next meeting. Wassalamualaikum warahmatullahi wabarakatuh.